Hi, it's Henry Shelford from ADHD UK here, ready to do another deep dive with Dr. Shyamal Mashru. Excited to have him here. We're going to bust some myths.
Hi,
Shai, how are
Henry.
you? Great, great to see you. So, look, well, this is part of a series of myth busting on ADHD, and this one is around medication. So, what
Yeah.
myth would you like to bust first?
Well, I think I've got a few questions that I kind of get from patients, and where I've seen on another forums. First one is, will my ADHD medication turn me into a zombie and change my personality? Um, so I think this is quite a common one that people worry about. So many people with ADHD have quite exuberant personalities, are from creative industries where they're maybe more extroverted personality actually works really well in that creative industry. And so they come to see me in clinic and they worry, is that going to be taken away? Are they going to become really robotic and zombie like? Um, which I think is a really valid question. And if you, especially if someone who's never taken any medication before, that would be potentially a worrying feature. We also see this in patients who have maybe had a history of taking antidepressant medications where they describe feeling emotionally numb. And that certainly is a common sort of effect of antidepressant medication. What I would say here with stimulant medication, where I would give reassurance to my patients, is stimulant medications definitely will not change your personality. However, I have had clients who are extremely extroverted, almost to the point of where it becomes a bit impulsive and reckless and dangerous. Stimulants will introduce that kind of pause before they might have impulsively acted out certain behaviors. And that might be perceived as a change in personality, but it's not a true change in personality. They don't lose their sense of humor or become really dull, but they might just where they might have impulsively blurted things out and then afterwards felt really terrible afterwards, thinking, "Oh God, why did I say that?" Or why did I reveal so much of myself to a total stranger at a party, for example? They will develop that pause that comes in to say in their mind, "Hang on, do I really want to be giving out this much information, for example, about myself?" Um, which might be perceived as a slight change in personality, but it certainly won't make them less creative. They will still have lots of ideas, but hopefully they'll still then be able to actually execute on those ideas and they don't just remain as an idea.
That's certainly how I think of it. Is that it allows me, um, to have all the ideas, but actually make them happen.
Yeah, exactly
The,
that. Exactly that.
when people talk about the impulsivity and extroverts being extroverted doing the things, and um, do you find those observations and therefore people inferring that personality's changed? Do you find those observations are from the individual or from their friends or people close to them?
So I think they will get some feedback from people close to them, where initially it might look like they have become a bit quieter. I have heard that before. And it's not necessarily that they've become quieter, but it's just that people around them are used to them being. Um, this is for people, this is not for all ADHD patients, of course, but everyone with ADHD will have their own different personality types. But these are for the more very extroverted people who might have almost sort of impulsively even said things that might have inadvertently offended people without even realizing. Or even from their partners. This is where I actually often hear this. Their partner will say, "Oh, I think they've become a bit more considerate, um, and they're a bit more attentive in conversation. They remember details which they would have just sort of maybe forgotten before or brushed to the side." Um, and so it's often appreciated in that way. For the person, they might feel, this is for people who are very extroverted, they might feel, "Oh, I have become quieter. Am I losing my personality?" It's just that they've never been used to having that internal pause, which maybe someone who doesn't have ADHD might have a bit more naturally. Um, but over time, I think with the good feedback that they end up getting from the people close to them, it's quite a nice new reality. And then when they've had periods I've seen where they've been off their medication, they can actually feel then quite out of control in certain social settings after a while. And that's not always then a nice feeling anymore.
The zombie sort of idea, where do you think that's come from?
That came so I think that came from children, actually. So so let's take your classically extremely hyperactive 8-year-old boy, right? Let's just take a very stereotypical textbook example. Why I say boy is because obviously that was in the literature when, the stereotypical naughty schoolboy or whatever they want to call it. Those kids were so hyperactive, literally running around the room constantly. And if you see these children, which I have done, they just cannot sit still for more than a minute. When you give them medication, the shift is so dramatic. They can sit down for 10, 15 minutes at a time. They're not running around bouncing off the walls. And to parents, well, it may be a wonderful relief, but at the same time, the child might look, quote unquote, zombified compared to what they were previously doing. And I think that's where some of this kind of rhetoric came out of. Because then when those meds wore off, they suddenly changed, not suddenly, but they gradually changed back to their usual presentation again. So because the shift was so dramatic in those types of children, and I'm particularly thinking of when Ritalin was being prescribed a lot of the time, that's where that concept came from, because the presentation looked so different. In adults, it's quite different. And a lot of that restlessness is internal. And actually, the meds just calm that internal restlessness down more than anything else.
I had someone come to me saying they were a writer and that they felt that they didn't have the same creativity when they were taking medication uh, as otherwise. What would you say to them?
So I've had patients who are writers as well. Um, what I would say to them, so I had a chap that was similar, quite a big author actually, and what I said to him was, well, where are the pain areas in your line of work? So he said to me, well, it's the admin related aspects of my business. So it was more the business as opposed to the actual writing. And so we've spoken about this before, about tailoring treatment to the individual rather than just, giving the same treatment to everyone. So for him, he I came up with a plan that, okay, why don't we give you a short acting stimulant regime that you take in the morning, you clear out all your paperwork, the admin related stuff that you need to do. You make maybe a plan of action in terms of what you want to achieve with your writing. And then by the afternoon, the meds have wore off and his creative thinking and juices are going, but at least they have some level of structure to them. So sometimes I've had situations where you can actually use medication just for the areas where the person struggles with, as opposed to just constantly using medication all day, every day in areas where they might not need the help with.
I think one of the important things you talked about customization is everyone's a unique individual plus ADHD. Everyone's reaction to, say, medication, there's going to be difference. And I think what you're saying is some people find that they want what was working before was working for them, and they don't want that altered in any way. I certainly don't think I'm less creative when I take medication. I'm able to hold the thought and process and think about it and take it further which is really different. But I thought it was interesting. So I think what you've said in that customization, but the fundamental thing that that person said to me was that they feel less creative on ADHD medication. Um, what's you responded saying, well, would you recommend personalization? What do you say directly to that someone is feeling less creative?
So what that person might be thinking is that, well, when I'm on my not on my ADHD meds, that excessive mind wandering is actually a very useful feature because I'm in the overthinking, I'm also coming out with all these different ideas, right? So what I'm saying to that is, well, if they do find that I can't deny that person's experience. If that's what they're experiencing, they're taking the medication, they're finding that that all of those different ideas are not coming out. If that is the case, I haven't come across that myself, but as in with my patients. But if that's the case for that person, then that's a very important feature to address as a clinician because that they're an author, that their ideas are important, their creativity is fundamental to their work. So what I would say to that patient is, okay, if that's what's happening, why don't you spend for example, either your morning or your afternoon jotting down your creative ideas, which you will normally not put into fruition, and then use your medication, perhaps in a short acting version, to actually then concretize and follow through with your ideas so that they don't just stay as ideas.
Oh, thank you. Interesting. Right. Are we all addicted to ADHD medication? Are we all just addicts at the behest of Big Pharma?
Well, so this is a very common question, especially when people first start medication, especially because one of the names of the stimulants is called an amphetamine stimulant. So people, think about the warehouse raves and ecstasy and amphetamines and speed and all these kind of things. Um, so essentially, if we look at addiction, there are features in addiction which you do not get from ADHD medication. First of all, one of the core symptoms of addiction is craving for the substance. You do not crave for ADHD medication. Um, Anyone who's watching this who's a cigarette smoker, for example, the way you crave for a cigarette, you will not crave for your Elvance in that way. You will not have a desire to have it in that way. You'll recognize the usefulness of it, but it's different to desiring and craving. So that's one core
Yeah,
feature.
I mean, how many people forget to have their first cigarette of the day, right? Like,
Yeah,
and so many people with ADHD struggle to remember to take their medication. You just you if you could forget things you were addicted to, like then
not
the
addiction.
addiction therapy would be much simpler. Like
Yeah.
it's so obviously untrue. I think where we had a challenge, particularly around the medication shortages, was making sure that we express the difference between valuing the difference something makes in your life and it therefore being very important, uh, and 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 the shortages therefore being very important, and making sure it didn't come across as addictive behavior, and that's obviously pretty challenging.
The second thing, in terms of core features differences between an addiction is and the medication is the withdrawal effects, right? So when you have addictions to, for example, let's take heavier drugs like crack cocaine. um, when you've had a long history of addiction and you can't have that drug, rather, you will develop withdrawal symptoms. Typically, it can even be fits or seizures. You see that in people with alcohol dependence, very severe alcohol dependence, having fits or seizures without the alcohol. Similarly, having similar withdrawal effects, hard withdrawal symptoms, physical symptoms. If you don't take your medication, your stimulant, typically for 24 hours, maybe up to 48 at the push, you'll feel a bit tired. You might feel like you want to sleep, lower energy levels slightly, and then that's it. I've never come across patients that are fitting or having a seizure or having the shakes, etc., because they stop their ADHD medication. So that's another feature of addiction that you obviously is not happening with the meds. There is a third core difference as well, which is euphoric effects. Now, patients that have a history of substance misuse, the guidance sensibly says in those patients, if you're going to treat with a stimulant, you might want to start with a non-stimulant, but if you're going to treat with a stimulant, especially if you feel like the history of drug seeking has been more due to self-medication of their undiagnosed ADHD symptoms, and especially if you feel that the person is really trying to be abstinent from illicit substances, so you want to go down the stimulant pathway, the guidance says is to give the long-acting stimulants and not the short-acting stimulants, because the long-acting stimulants act as a prodrug. They, when they are taken, they need to be broken down within your system before the active ingredients are released. So if you break open a capsule of Elvance and try and snort that like cocaine, you'll just get an itchy nose. It will produce no euphoric effects absolutely whatsoever. However, short-acting medications can, at a very low level, nothing like taking the actual illicit substance, but mimic small amounts of euphoric effects because they are the active substance. So with those kind of clients, we would generally either to go for a non-stimulant or a long-acting stimulant to avoid any euphoric effects. Because if you have an addictive tendency towards euphoria, you don't want them to try and mimic that with their medication.
Yeah, I've certainly spoken to someone who tried the stimulant medication, and they do have a history of addiction and using illegal drugs, and they were just like, I don't want any. It was tough getting out of where I got out. And I just don't want to go near this. And not the same effects, but just enough echo to make them go, this isn't. I've also spoken to people who were taking street drugs um, to help them cope with their day, as someone with untreated ADHD, and then coming forward for help, saying, I do want stimulant medication. I basically have a pretty good idea that I think it's going to help, and um, I think it's important, and that has made a life-changing difference to that
Yeah.
individual. And I think it's important to know that addiction isn't uh, an absolute a history of addiction isn't an absolute barrier to getting ADHD medication, and actually, for many, it's part of the treatment plan.
I think just a caveat, it needs to be done with a lot of caution. What I mean by that is, um, if the person was on top of their ADHD meds using a lot of other illicit substances, it can be really dangerous on the heart. So if it's going to happen,
Yeah,
it needs to be done in a facility that, you know, that they can test for things essentially.
yeah.
That's all I will say. You're right, of course. You can deny the patients of that type of treatment, but it- there is a lot of clinical risk there which needs to be
Yeah.
managed.
I think some people are in a deep hole and get very worried that there's no the options out are limited, and they've struggled to get out. I met someone who had a significant alcohol dependency, and uh, were also drinking a lot of caffeine. So it'd be caffeine in the morning to uh, stimulate them, get them going, and then they couldn't sleep, and they were then using alcohol in part for that, part for other reasons, and they just couldn't get out of that knot. And I think medication for ADHD was something they wanted to look at as an option, but were finding it very hard. So I think, yeah, I think it's important people know that with proper guidance, there are ADHD treatment options that can help them also as they work on their addiction. Which is quite a turnaround from the start of this question, which was, are ADHD medications addictive? And
I
where this
think
is
the
ending
answer
up is saying that for a lot
is
of people, they're being used to help them deal with historic addiction. But and yeah, and the newer generations obviously being much harder to abuse, which is important because in the past there was illicit trading of particularly, I think that was something you sort of saw as a trope in America. Yeah, so not addictive. People genuinely forgetting to take their medication. That is a hallmark of something that's not addictive.
absolutely.
Um, Next myth. You started to touch on it a little bit, but ADHD medication, taking it if you've got anxiety or depression,
Yeah, so
and
this
not
is
taking medication for those things too.
absolutely. So, first thing, as a clinician, one thing we see, patient comes to see me and has been taking antidepressants or they're on antidepressants. Now, this is one more for the clinicians, I think, as well as the patients that are viewing this or the people that are viewing this. Do not recommend, as a clinician, if someone's been on a year's history of taking a particular antidepressant, do not tell that patient, stop your antidepressant immediately before we start ADHD medication. That is, in my view, the wrong advice. The reason why clinicians are doing that is because there is a very low risk of something called serotonin syndrome, which is an interaction between a stimulant medication and or even a non-stimulant medication and the antidepressant. I've seen well over 10,000 people, and I might have come across serotonin syndrome once. By far and large, if you stop your antidepressant overnight, you will get horrendous withdrawal effects. So most antidepressants, well, all of them really, need to be, if you are going to come off them, weaned off very carefully. I would not suggest, so if you're a patient going to a clinic for an ADHD assessment, it is possible that your depression and anxiety symptoms come from untreated ADHD. And that's fine. And you've been put on an antidepressant, you might not be finding it particularly helpful. Once you're diagnosed with the ADHD and you've started on ADHD medication, once you get optimized on the ADHD medication, then carefully wean off the antidepressant. I've had so many patients that then try and come off the antidepressant immediately. They feel horrendous because of the withdrawal effects of the antidepressant, and they attribute that to the ADHD medication, the horrible withdrawal effect. The other type of, so coming back to the question about you can't take ADHD medications if you have anxiety, depression. So the first bit I'm trying to say is if you're on your antidepressant medication and you're starting ADHD meds, don't stop the antidepressant, get optimized on the ADHD medication, then see how you emotionally feel before coming off the antidepressant gradually. Some patients have both comorbid anxiety and depression, which is meaning that they've got a deficiency in their serotonin, which is being helped by the antidepressant, as well as ADHD, a deficiency in dopamine and noradrenaline. And those patients actually will need to be on both types of medication, and they'll do well continuing on both types of medication. And then the third patient is the one that comes in with anxiety and depression symptoms. None of the antidepressants have worked at all for them. They come to you because they correctly probably feel that their ADHD, undiagnosed ADHD, might be causing the depression and anxiety symptoms. And then they feel emotionally a lot better when they go on ADHD medication. So I hope those different scenarios clear up that question.
Yeah. So we commonly see people with anxiety and depression talking of being treated for years, decades, and then recognizing they have ADHD. And as you've just said, like everyone's unique individual plus ADHD, they might be finding they've got depression, anxiety as a consequence of years of untreated ADHD, and the treatment and recognition and treatment changes that for them. And it might be that they're an individual, unique individual plus ADHD, but unique individual plus ADHD and depression and or anxiety, and that's um, part of what it is for them. But and those things are different. The next myth for us to look at is that around ADHD medication is that natural remedies are better than pharmaceutical ones. Which, what do you say, Shai?
Right. So I'm going to add a disclaimer here that I am not affiliated with any, pharmaceutical companies or any natural remedies companies here.
I was thinking
I
of
went to an
treating my
interesting.
ADHD with homeopathy, and I was planning to make it even stronger by extra diluting it with a glass of water.
Okay. So, in fact, I went to a conference. I don't know if
Yeah.
you went to this
If
conference. It was
I've
a couple of
offended
years
anyone
ago
about
in.
homeopathy, I really don't mind. I think it's just such nonsense. It really annoys me.
I'm not going to comment anything about homeopathy here.
Fortunately, they're not
Um,
an aggressive
there was
lobby group.
a couple of years ago. I think it was a couple of years ago. There was a, I believe it was a World Congress ADHD conference, which was actually all around. The theme was all around non-pharmacological interventions in ADHD,
This is
and
not like, because
essentially,
obviously, like, there are lots of good
I'm not talking about.
interventions that aren't pharmaceutical.
No, no, no. No, no, no. So I'm not talking about coaching. I'm not talking about talking therapy. I'm talking about um, supplements, certain vitamins. Um, I mean, that's the main thing that I'm actually talking about here. And there were a few lectures there, and they were, to give a lecture at those kind of conferences, you have to have done really big scale studies, thousands of individuals. And the bottom line from them was that all of and I'm not trying to start a war here. I know lots of people use
You
vitamins and
started a war.
supplements, and actually, some patients have told me they find it really helpful. Okay, so I'm only going to tell you what the research had showed at that time. Okay, and things could have changed
Yeah.
since then. The research showed at that time that all of those vitamins and supplements showed negligible, statistically significant difference in ADHD symptom improvement. I think the only one that had a very mild improvement was
Okay. I
omega
was just
3.
about to ask on that. Yeah.
That was the only one that had a really mild improvement.
Out of interest,
Um,
different to someone without ADHD, because I thought omega-3 was beneficial for all.
Help cognitively anyway, right? Can
I genuinely
cognitively
don't know.
enhance
Like
anyway.
like a,
Can. Um, but that was the research, and I don't think that research has actually really changed much over the time. Um, Having said that, anecdotally, I will have patients that tell me they've used different supplements, etc., and they found it helpful. And again, I'm not taking away from someone's personal experience here, but I'm just going on what the
yeah,
research has
as a
shown.
charity, we have to play defense on this a lot. So we have lots of people coming into support groups trying to sell whatever is the latest sort of fad in. So like gojo berries or whatever people are coming on. Like it's not got a good evidence base. There is obviously an issue around the fact that because they're natural products, they're not patentable. So the cost of research, it's hard to get the research funded because it won't generate an income stream in the same way a pharmaceutical will, which is always is the big challenge around supplements and proving difference. Yeah, when this sort of topic comes up, I always just think about things like, that are terribly poisonous in the natural environment, or toxic chemicals that are naturally occurring. You're just like, just because it's natural doesn't mean it's good. And I think it's not a, a basis that works absolutely. Like it's, I nearly said works naturally. Oh, conflicted language. Okay. So I think what you're saying is some people find supplements useful. There's no evidence base of serious difference for anyone with ADHD from any supplement, and uh, certainly we see, if we think around something quite, I think people would consider natural, so caffeine. I think we see overuse of caffeine quite commonly as a self-treatment mechanism for ADHD.
Absolutely. And then also on the flip side of that, once their meds get optimized, they often don't feel the need for having so much caffeine anymore. So,
Yeah, it's an interesting
you know,
aspect that that is a natural product being used to sort of but it has such massive, the quantums have pretty significant impacts on people's.
well, also it's short-lived as well. The coffee is not going to last the whole day long, is it? You know, that's why they're taking 5, 6, 7 cups of coffee, right? Um, but the interesting thing that I know is that when they get really optimized on meds, they just don't feel the need for that anymore. Um, so yeah,
I'd love
that's
to
what I
see
would
a
answer
study
my
of
my
like
careful answer.
excess caffeine drinkers and screening for ADHD, like what percentage are actually undiagnosed ADHD. It's just
So
be curious. It'll definitely be over the population expectation. Just to what extent? Right. Do last myth we're doing in this session. Do ADHD medications work instantly?
So, depends on the patient is the answer. Everyone
That
has
is an
different sensitivities
incredibly
to
annoying
medication.
answer. Just saying.
Well, it is the truth, right? So there's different courses. One, you'll have the patient that said, "That was phenomenal. I've never felt so clear in my mind. It was so dramatic."
I think there's a lot of this on
And
social
that can
media.
happen.
I think it can set a real false expectation of like this. What just
So but there is a group of patients that do experience that. Right? Then there's a second group, which I think is a bigger group, which might experience that in the first few days of the low dose of their starting stimulant medication or whatever they're using. And then they'll say, yeah, but over time it's not working anymore. Those patients just need to be optimized on the right dose. They're just not at the right dose yet. And then there's a third group of patients who are not very sensitive at all to medication. And all along the lower doses, they are feeling like the medication is doing absolutely nothing until they get to much higher doses where they might experience something. And then there's a fourth group of patients that even at the low dose of medication are so riddled with side effects, which is a small group of patients, that they don't want to continue their medication. So everyone has different sensitivities to medication. And I think that probably goes for most medications, not just ADHD medications.
yeah, and because obviously it's impacting your brain. Yes, some people, um, I think it's see and feel those effects not very directly.
I would just like to add one last
Out of
note
way.
as a caveat, is many people who have never been on meds would be terrified to try starting any medication, particularly maybe ADHD medication. In my experience, if you go with a trained and experienced person who starts at a low dose, does your titration carefully, follows you up carefully, like I say, I have definitely seen well over 10,000 patients, and there's no exaggeration. I don't th I don't think I cannot recall anyone being significantly harmed by their medication. They took one pill and then they were in hospital. I've not seen that before, right? Especially if you start at a low dose and you do it gradually, properly. Um, so I just hope that gives some people reassurance. I'm not trying to push everyone on medication. I'm definitely not saying that. But there are people naturally, if you've never ever tried meds before, you're watching these videos, you're like, oh my God, should I do it? Should I not do it? I have not seen someone fatally injured off a 20 milligram capsule of Elvans, for example. I'm not saying it can never happen, just going on my experience.
Thank you for. I think that's important to say. Yeah, I think it is such a complex decision, and it's one an individual makes, and it's important these sort of myths discussions around ADHD and medication, because actually there's so much myth making around negative on ADHD and medication. Like, you know, people will weigh in on ADHD medication at the school gate or in your life. People who have no experience of it at all. And it feels fairly unique to ADHD, like that people will do that, like they'll weigh in on your choice of medication. I don't, they rarely do it for other conditions. Um, and so taking the time to sort of listen to this and learn and make your own path. Um, out of out of interest, uh, what sort of percentages do you see when who come to you and then opt for medication and opt for medication long term? I do think that in this country right now, there's quite a significant skew that people may recognize they have ADHD and decide to go to see a specialist because they've made that decision that they want to opt for medication. So it actually doesn't express the whole population. But so what do you see in terms of people coming to you, essentially opting for medication and then staying on medication?
Probably, I would say people who get diagnosed with ADHD, 70 to 80% opt for medication, and that's probably why they might have come. But I'm seeing a certain group because that's probably why they might have come to see me in particular. The other 20-25% are probably the ones where they've come for an assessment, and I've actually also recommended, listen, I don't think you want to go down the route of medication. You're very psychologically minded. You're doing really well. You've done well with talking therapies in the past. Why don't you try coaching first? But I'm seeing a skewed group, Henry, because they're probably coming to the psychiatrist because they also wanted that
Yeah, because
route.
it like for example, if you see a psychologist, they can't provide medication and are less expensive often times. So that group will probably see a skew the other way. Then opting to, so you got what of that percentage? How many then opt to take medication long term, and the percentage that opts to stop?
More than half will continue to take their meds. Whether they remain on the same dose is a different story, and how they use it is a different story. Some people might start with 7 days a week and then they drop off on the weekend and things like that. But more than half, I would say, end up
So more
staying on their
like,
meds.
just because more than half encompasses half the population. So like it's we saying 50, 60, 70-ish%. I'm not.
I would say so,
Right,
yeah.
I gave you
The
too many
problem that
ishes.
we've
Are we going
got
for
is,
60%?
well, I can't because I'll tell you why I can't. Because I see people in my private clinic over the years, they might end up going down the NHS pathway and then I
Yeah.
don't see them anymore, which happens a lot, and that's fair enough. So it's hard for me to give you that longitudinal information.
Okay. But it's only you see a number opt to stop, which I think.
Yeah, significant number opt to stay
And
on
why
meds
do
though.
people opt to stop?
Change in life circumstances, you know, they've tried other strategies which they found more helpful, like coaching.
I think that's an
Um,
important one. That ADHD people use medication as a helping hand. It actually helps them help
yeah,
themselves. And a portion of people go get to a point where they're like, you know what, I actually don't need this helping hand anymore. I've got I've changed
your place.
changed, yeah, got myself to a place where I don't need this anymore. And that is a path that many tread.
Yeah, that is. I wouldn't I I wouldn't say that's the majority of my
Yeah.
patients though. But again, I might be just seeing a skewed group of patients, you know.
It's wonderful as ever. Shai, thank you so much for doing these. I think these deep dives are really valuable. I think this myth busting. We've got another myth busting to come up. So this is one of a series. Do you want to just tell people about your clinic? Little plug at the end.
Yeah, so I run a clinic called the ADHD Health Clinic. It's based in London between Marylebone and Baker Street Station. A big important thing I want to add that happened to our clinic 2 weeks ago. We've got CQC registration for online consultations. So what that means is the clinic will be expanding. I will have other clinicians, uh, colleagues that I've worked with working in the clinic as well, so associates. I will have more coaches, and we are also expanding to autism assessments as well, because you see so much overlap in this work. So I will be expanding for autism assessments, and we'll also be doing with one of our partner providers, children's services at some point too.
Great. Well, thank you. Thank you for doing this. I look forward to seeing you next time. Thank you.
Thanks, Henry.
So that's the latest in our series of deep dives. This one focused on myths around ADHD medication. So you got to do the bit at the end saying we're a tiny charity. We can do none of these things without donations and fundraising from you. We get no government funds. Every month is tough. Dr. Mashru has donated his time, for which we are very grateful. Yeah, so do please consider donating or fundraising, and do tune in for the next one. Thank you very much for joining us. Have a great day.